So, have you ever wondered what the big deal is with good cholesterol? Well, today we're going to demystify one of the most important numbers for your heart health, your HDL. We're going to get right into what it is, why it matters, and most importantly, what you can actually do about it. All right, let's kick things off with a simple idea. Just imagine for a second that you've got this tiny, dedicated cleanup crew working inside your bloodstream like 24/7. Their whole mission? To keep the super important highways of your circulatory system clear of any gunk or dangerous blockages. That, in a nutshell, is the hero of our story today, HDL cholesterol. First things first, it's absolutely crucial to get this. Not all cholesterol is the bad guy. Not at all. In fact, the best way to think about it is like a classic good cop, bad cop story that's playing out inside your body right now. And this slide, it just lays out that whole conflict perfectly. You've got LDL, the bad cholesterol. That's the stuff that can build up in your arteries and cause all sorts of serious problems. But then you've got our hero, HDL, the good cholesterol. Its entire job is to swoop in and clear all that nasty stuff out. So let's get to know this hero a little bit better, right? What exactly is its mission? How does this cleanup crew actually operate to keep you safe every single day? Okay, so the official kind of sciencey name is high-density lipoprotein. Sounds complicated, I know, but honestly, all you really have to remember is that it's a type of fat, a lipid, that acts as your body's personal cleanup crew. Its whole purpose is to stop harmful stuff from building up. Simple as that. I love this because it shows you exactly how HDL gets the job done. It's a really smart four-step process. First, it patrols your bloodstream, kind of like a security guard. Then it finds and grabs that troublesome LDL cholesterol. Step 3, it basically hails a cab and carries that LDL straight to your liver. And finally, the liver takes over, breaks it down, and gets it ready for removal. It's an amazing little system. So why do we care so much about this cleanup mission? Here's the bottom line. When your HDL is doing its job, it directly lowers your risk for some of the biggest health threats we face: heart disease, heart attack, and stroke. A strong cleanup crew means a well-protected you. So, how do you figure out how strong your personal cleanup crew is? Well, it all comes down to getting your score with a really simple blood test. Yet, getting your HDL number is super straightforward. It's a simple blood test, and it's almost always part of what they call a lipid profile. That's basically the whole cholesterol checkup, where they also measure your LDL, triglycerides, and total cholesterol all in one go. Now, to make sure the results are as accurate as possible, there are a few things you gotta do. Usually, you'll need to fast, so no food, for about 9 to 12 hours beforehand. It's also really important to tell your doctor about every single medicine and supplement you're taking. And you'll want to avoid alcohol too, since all that stuff can mess with the results. And what about the test itself? Honestly, it's incredibly safe. You might feel a little pinch or sting when the needle goes in, but the whole thing is super low risk and it's over in just a few seconds. Okay, the test is over, you've got the report in your hand. Now for the really important part. Let's break down what these numbers actually mean for your health. This right here is the magic number. This is what you're aiming for. An HDL level of 60 milligrams per deciliter, or MGDL, or higher is considered optimal. If you hit this number, it means your cleanup crew is in great shape and doing a fantastic job at protecting your heart. Now, on the flip side, if your levels are too low, that puts you at a higher risk. And here's something you really need to know. As this chart shows, the definition of too low is actually different for men and women. For men, anything below 40 is a red flag, and for women, it's anything below 50. And you know that saying, you can have too much of a good thing? Well, that can sometimes be true here too. A level over 80 is considered elevated. It doesn't automatically mean something is wrong, but it can sometimes point to other things like genetics, an overactive thyroid, or even high alcohol use, so it's definitely something your doctor will want to check out. So, what if your number comes back a little low? This is the best part of the whole story. You are not powerless here. If your cleanup crew seems a little small, you have the power to call in reinforcements. If you look at the common causes of low HDL, it actually gives you a perfect roadmap for how to improve it. As you can see right here, so many of these key factors are about lifestyle, not getting enough exercise, carrying extra weight, and certain things you might be eating. And that brings us to the main takeaway, the thing all the experts agree on. The number one most effective way to boost your HDL is through lifestyle changes. It really all boils down to moving your body more and making some smart choices about the food you eat. So at the end of the day, understanding your HDL number is just one chapter in your overall health story. It's a really important piece of the puzzle, for sure. But the real power comes from what you do next. from the chapter that you get to write based on what you now know.